Hello, good afternoon.
Good afternoon.
So I'm your student nurse for today. I'm Chanel. May I know your name?
I'm Jared.
Okay, Jared, how old are you?
I'm 14.
Okay, so today I'm gonna be assessing your musculoskeletal system by asking you some question for you to answer. Is that okay with you?
Okay.
And after it, we'll proceed to physical examination.
Okay.
So let us start for the history of present health concerns. So, have you had any recent weight gain?
No.
So, describe any difficulty that you have when you're chewing. Do you have difficulty in chewing?
No.
Okay. Describe any joint, muscle, or bone pain you have. Do you
No.
have any?
No.
Okay. So, do you have any problems or injuries you have in your joint or in your muscle or bones?
No.
You don't have. So, when were you last tetanus or polio immunization?
Last year.
Is this polio or tetanus?
Tetanus.
Tetanus last year.
Yes.
How about polio immunization?
Katong bata pa ko.
Okay. So, have you ever had your diagnosed with sickle cell anemias or lupus or osteoporosis?
No.
No. So, do you have a family history of rheumatoid arthritis, gout, or osteoporosis?
No.
So, what activities do you engage in to promote health or muscle and bones? What activities like exercise, diet, or
Exercise.
so what do you exercise? What kind of exercise?
Jogging and biking.
So what are the medications are you taking?
I didn't take any medication.
So do you smoke tobacco?
No.
So do you drink alcohol?
No.
Caffeinated beverages?
Yes.
Yes. What is it?
Coffee.
Coffee, and is there any?
No. Only
Okay.
coffee.
How much do you drink?
Once or twice a week.
So describe your typical diet in 24 hours. What do you eat in 24 hours?
Veggies, meat, canned goods, and etc.
So are you able to consume milk or milk containing products?
Yes.
So what is it?
Fresh milk.
Okay. Do you take any calcium supplements?
No.
So describe your activities during a typical day. What activities do you engage in a day? Running, like
Running.
what do you do in a day?
Biking.
Biking,
Walking down the stairs.
walking the stairs.
Yes.
So how much time do you spend in a sunlight?
Not so long.
Not so long. After a minute or hour?
A minute.
Minute. So describe any routine exercise that you do. What exercise do you do?
Running.
What about others?
Biking.
Biking. Is that it?
Yes.
So describe your postures at work and leisure. Do you wear shoes do you wear?
Pump shoes.
Shoes. So describe your posture when you study. What posture do you sit or
Sit.
sit? Kanang naay sandiganan sa likod imong bangko.
Yes.
Do you use any special footwear?
No.
No. So do you have difficulty performing your normal daily activities?
No.
No. Do you use assistive device?
No.
So how have you had your musculoskeletal problems interfered with your ability to interact?
I didn't experience that.
How did you view yourself before and you had this musculoskeletal problem? Di ba, you don't have problem?
Wala ko'y problem.
So has your musculoskeletal problem added stress in your life?
No, I didn't experience that.
So have you ever had your bone density screening?
No.
So that's all the questions I'm gonna be asking, and let us proceed to physical examination, okay?
Okay.
Okay, let us now proceed to the physical examination. The first one I'm gonna do is observe your posture while sitting and standing, okay? Observe client's posture while standing with the feet together, noting alignment of the head, trunk, pelvis, and extremities. Also observes client posture while sitting. The next one is I will observe how you walk. I will observe your gait. So can you walk around for me back and forth, okay? Observe gait for base support, weight bearing, stability, feet posture, stride, and arm swinging. So I will palpate and inspect your temporomandibular joint, okay? So I will place
Okay.
my finger in this side, and can you open your mouth wide for me? Okay, can you close it? Open. So close. Do you hear any clicking?
Yes.
Okay. I will inspect and palpate your sternoclavicular joint, okay?
Okay.
Inspect and palpate for location to midline, color, swelling, pain, and masses with client sitting. Observe your spine, thoracic, and lumbar spine, okay? Can you turn around? Observe the cervical, thoracic, lumbar curves from side then from behind. Observe for symmetry, noting differences in height of shoulder, iliac crest, and buttock creases. Okay, so next I will palpate your spinous process and paravertebral muscles, okay? For tenderness or pain. So do you feel any pain or tenderness?
No.
Okay. So next I will test for room for the cervical spine. So can you touch your chin to your chest? Okay. And can you put your head in a neutral position? And next is look up. So put your ear to your shoulder. To the other side. Okay, and turn your head to the right and left. I will test room of your lumbar spine. So can you bend at waist? Okay, bend upright. And bend backward. And bend side to side. So next, I will test for leg and back pain. So I will raise your leg. If the client has low back pain that radiates down the back, perform the straight leg test to check for a herniated nucleus pulposus. Measure your leg. Measure leg length if one leg is longer than the other. Measure from the anterior superior iliac crest crossing over the knee to the medial. Okay, I will inspect and palpate your shoulders and arm. Okay. Palpate for tenderness and swelling. Anteriorly, palpate the clavicle, acromioclavicular, subacromial area, and the biceps. Posteriorly, palpate the glenohumeral joint, coracoid area, trapezius muscle, and scapular area. Test room by having the patient flex, move arms forward with elbow straight, abduct, bring both hands in front of the body past midline with elbow straight. External rotation, elbow flex, bring hands behind the head. Internal rotations with elbows flex, bring arms behind back. Test muscle strength by performing room against resistance. I will inspect and palpate your elbows for size, shape, deformities, symmetry, and color. Test the room for your elbows, okay? The first one is flexion and extension, like this. Okay. Can you perform to the other one? Okay, both. The next is supine and prone, like this. The other one, both sides. I will inspect and palpate your wrist. Inspect for size, shape, symmetry, color, and swelling, and palpate for tenderness and nodules. So let us now perform the squeeze test. Palpate the snuff box. So test for room by flexing and extending the wrist. Hyperextend wrist, perform ulnar and radial deviation. Next, let us perform the Fallen test, okay? So, follow what I do, like this. Next, I will perform the Tinel test, okay? So, what do you do when the symptoms are worse?
I will consult my doctor.
Okay? So, I will inspect and palpate your fingers and hand. Inspect size, shape, symmetry, swelling, and color. Palpate for tenderness, swelling, bony prominences, nodules, and crepitus of each interphalangeal joint. Okay, let us now proceed for testing your thumb. So follow what I do, ha? Ask the client to spread fingers apart, make a fist, bend the fingers down, and then up. Move the thumb away from the finger, then touch the thumb on the base of the finger. Okay, I will inspect and observe your hips for symmetry and shape. Okay, can you turn around? With the client standing, inspect symmetry and shape of the hips. Observe for convex thoracic curve and concave lumbar curve. Palpate for stability, tenderness, and crepitus. Okay. Okay, I will palpate and inspect your knee. With the client supine, then sitting with knees, Dangling, inspect knees for size, shape, symmetry, deformity, swelling, pain, and alignment. For room for the knee, so can you bend each knee up to the chest? Okay, the other one. Okay, and then straighten it. Okay. Top patella, if it rebounds against your finger, fluid is present. Press here to milk fluid behind patella. Position patient in supine with knees fully flexed. Place one hand on the heel and the other on the knee. Apply pressure with both hands and gently rotate the foot. The test is positive if audible or palpable clicks occur. Okay, I will inspect your sitting position for shape alignment. Okay, can you stand? And can you walk back and forth? Again. Okay. Good. Palpate ankles and feet for tenderness, temperature, swelling, or nodules. Palpate toes from the distal and proximal, noting tenderness, swelling, and bony prominences. Palpate the metatarsophalangeal joints by squeezing the foot from each side of
No.
your thumb and fingers. Let's test for room, so follow my feet. Up, down, up, down, side, side, rotate. So that's it for our physical examination. Thank you for cooperating. Enjoy your day.
Okay.